Okay, so we're moving on to what I like to consider the second group of levels. So I like to, in my mind, I like to classify like 1, 2, and 3 as like a set, and then we have 4, 5, 6 as like another set, and then 7 and 8. So we'll start with Rancho level 4. And in general, some people think, like people who had a brain injury, they're super like aggressive and agitated and things like that. And I mean, in a certain way, sometimes they are, but that is not really what should be distinguishing people with a brain injury, right? Some people become agitated and aggressive. Some people don't. So this is level 4. And I guess like this level, it's one level that most people are like, wow, like, oh my God, right? So this is confused, agitated. And confused, agitated, when the brain begins to wake up and it starts to register the environment and what's going on, it might have some difficulty controlling the level of response. Let's just define agitation. So this is a state of restless anxiety. So it's clinically increased non-purposeful motor activity, usually associated with internal tension. So think about those times that you've experienced that internal tension when like something like, I don't know, you're like very upset at something that happened like at a store or like at a restaurant. You're like, right? So it's disturbing, right? So agitate, or like, if someone's like, if you're in the phone with someone and with like a business or whatever, and they made a mistake at something, and or something that you didn't expect happen, and you're pretty like upset. So that's the experience that they're going through. And imagine that plus the brain injury, right? So all the chemical things going on in the brain. So confused, agitated. So this is a period of time where your patient is in a heightened state of activity and severely confused, disoriented, and unaware. So the behavior is frequently bizarre and they are inappropriate to the immediate environment. They are unable to perform self-care, and if they're not physically disabled, may perform automatic activities as part of their agitated state, but not necessarily as a purposeful act. So what are some examples of agitated behaviors? So this is a perfect example of agitated does not mean just yelling and screaming, okay? It might mean some other things. So short attention, restlessness, disproportionate reaction to stimulus, pulling at tubes and lines, rocking, rubbing, moaning, impulsive, impatient. There we can introduce combative, uncooperative, emotionally labile, rapid, loud, or excessive talking, aggressive towards others, disinhibition, bizarre behaviors, and perturbation of motor and verbal. And sometimes we get to the verbally aggressive, physical, verbally aggressive, like screaming, okay? So, again, why is my patient agitated? We need to think about what's going on. So imagine nurses talking, people talking like in the room, or, the unit, there's noises, there's machines beeping, they're in pain if they have like, some musculoskeletal problems, the metabolic cascade, lines and tubes are connected, they have restraints, they have here IV, they have all this things going on, the vital signs, they have the blood pressure cuff, it deflates, and then it's inflating again, people coming in and out, lights on and off, sleep cycles. So all of that will cause the agitation. So tips for treatments. Always orient them. Manage the environmental factors, so analyze the triggers and minimize environmental distractions. Establish a daily routine, so a consistent daily routine, even if they're in the hospital, okay? Model a calm behavior, so less words, if you can. Do not force them to do things. Give breaks, like a commercial. I like to call this a commercial if they are kind of like getting a little agitated, and you can feel it, right? Give them like a little commercial, like select activities that they enjoy. Here's a good thing to introduce a little bit of the optimal theory, like letting them take over, like, would you like to do this, or would you like to wipe your face, or would you like to do this, if you can, right? Because sometimes they're not going to do it. You can focus a lot on like automatic activities, like ADLs, sitting on the edge of the bed while they are wiping their face, or things like that. So I say busy hands or happy hands. So if you can give them something to hold, this will prevent doing something else with their hands, like, if they are physically aggressive. So, holding a ball, holding whatever with both hands would be a good idea. I've heard people say, like, try not to be like in front of them, because here is a perfect space. If they are, again, physically aggressive, just kind of be like, next to them. So that's a good idea, in case if they are, like, let's say, sitting at the edge of the bed and things like that. So here you need to remember that the patient cannot focus on tasks for a long time. If there's too much things going on, such as many visitors or a lot of things going on in the room, the patient might become more confused or agitated. So they might be able to speak, but they might use the wrong words, or mix up the order of their words. Now, the good thing about this stage is that this stage is a sign that the patient is getting better, right? They're progressing through their Rancho stages. When the patient is relaxed, use this time to help them improve their ability to respond correctly. Work in a quiet environment so the patient does not become agitated. Again, work on ADLs. Yes, I know that we are PTs, we're not OTs, but we are working with people with neurologic conditions. And guess what? ADLs is something that has to do with the brain, right? We need motion to do ADLs, and we need to know the correct sequence for brushing your teeth, for washing your hands, and all of that is part of neurologic therapy. So don't be afraid of incorporating ADLs. Okay, it's very functional. You can incorporate, sitting, standing, things like that. Try not to, if they're sleeping, try not to startle them. Just very calm. Start, maybe trying to wake them up very gently. If the patient is not talking, you can incorporate some other gestures or head movements. So like, are you in pain? Yes or no? So simple things like that. Again, one person talk at the same time. Limit the number of people in the room. If the patient becomes agitated, don't just freak out and get out of the room. No, you stay with them until they calm down, and touch them and speak to them in a calm voice. Sometimes it might be a little disturbing just to be with someone who is agitated, but just remember that this is a result of the brain injury. They don't mean to be like this. It's not their intention to be like this. And you just keep in mind that this is actually a good thing. They are progressing through the stages. So anger, swearing, or crying is the way that the patient is responding to stimulus. They are not aware of how they are behaving. So just, keep that in mind as a therapist. And if you have someone who is experienced with patients with brain injury, ask them for advice on what to do when my patient is agitated in the moment, and I'm in acute care. What do I do? And we will be having someone talk to us about this topic. What to do when my patient is agitated in the acute care setting or in the inpatient or subacute setting. So we have that for you. So that was Rancho 4, Confused, Agitated.